Hello, my name is Deanna. I am a Master's of Social Work graduate student at the University of Kentucky College of Social Work. I will be discussing today the problem we are facing as a society across our nation and here in Kentucky. Individuals with mental health issues are struggling with the lack of insufficient number of accessible mental health care facilities in our rural communities. There has been a dramatic need for an increase of mental health care professionals over the past few decades. An increase in unemployment, alcohol and drug abuse, domestic violence, and suicide rates has had a major impact on this need. The largest impact has been on our rural communities across the United States. Kentucky is the 10th most rural state in the nation. The area is rich in natural resources, but it lacks the physical and social infrastructures that are necessary for economic growth. Resulting from this, Kentuckians must contend with a major issue that affects every rural community of Kentucky. There is a severe shortage of mental health facilities. There is a lack of health care accessibility and affordability in many of the rural areas. A shortage of doctors and healthcare facilities in some of the rural parts of the state drives many of the health access problems. The forgotten rural communities of the Appalachian region of Kentucky are struggling to survive mental health issues. They are in grave need of interventions. To begin engaging with the population, social workers and other mental health care professionals must be willing to go into these rural communities and begin to have interactions with this population and conduct a thorough needs assessment of accessible mental health care services. Before healthcare professionals can achieve an accurate assessment of this population of clients, they must first become familiar with each community's culture. Many of these rural communities rank among the poorest communities in the state. Although most live below poverty level, this culture of people value their dignity and have the determination to provide for themselves. Social workers and other mental health care professionals must listen to the concerns of these communities and those who are affected by mental health issues and their inability to access mental health care treatment. Many social workers who come into the rural communities to perform a needs assessment are not familiar with the culture of the people within these communities. Because of the lack of cultural competence, it is extremely important that they do not convey any form of personal biases. They can achieve this by acknowledging those biases that are both conscious and unconscious, so that they are aware of their existence. Healthcare professionals must work towards building trust with these individuals. This can be achieved by conveying the message that you are there to help and not by putting actions behind your words. Social workers should understand that each rural community is composed of their own unique cultural differences. They must be willing to accept the diversity so that they can begin to develop an intervention plan. Social workers and other mental health care professionals can host town hall meetings where there is an open forum. This allows the healthcare professionals to hear directly from the affected population. Social workers should look for members of the communities who show strengths in their abilities to help bring change. An action team should be formed, and individuals who show their strengths should be a major part of the action team. Government involvement should occur in the intervention plan. Leaders in each community can find information on who their state representatives and senators are for their area. The leaders can find out what bills have become laws and what bills are still on the docket. By doing this, communities can become self-advocates. They can meet at the General Assembly to rally for the passing of bills that directly affect their ability to obtain accessible mental health care services. Kentucky rural communities across the state are suffering from mental health issues due to their inability to access mental health care treatment. These rural areas have few behavioral health practitioners, particularly ones who are qualified to provide specialty treatment. There is approximately 70% of Appalachian communities in Kentucky that have mental health profession shortages. Throughout the U.S., there is more than 75% of all counties who are experiencing mental health shortages. Half of all U.S. counties have no mental health professionals at all. The prevalence in rural Kentucky is estimated to range between 38 to 51% of their national shortage. Recruitment of practitioners in rural communities has been an ongoing problem for decades. The Substance Abuse and Mental Health Services Administration has documented difficulties in recruiting and retaining staff to replace the county's aging behavioral health workforce. The Health Resources and Services Administration estimates that more than 7,700 professionals are needed to fill existing behavioral health workforce gaps. There is challenges to recruiting and retaining substance use treatment staff in rural areas, which include low pay compared with peers in other settings, professional isolation, difficulty for spouses to find work, few social outlets and educational opportunities for their children, and difficulties adjusting to rural life. For these reasons, most individuals want to stay in the metropolitan areas once they have finished their college programs. They know that jobs are plentiful, pay is good, their children have access to great educations, social activities are abundant, and the adjustment to city life is at its minimal. Kentucky legislative policies in Kentucky have been implemented. The Kentucky Home Place Project, KHP, began in 1994. This project is funded by the Kentucky legislature. It is now a permanent budgetary component of the executive branch. The purpose of this project is to motivate individuals to provide their personal health behaviors through self-awareness and self-actualization. Individuals and communities across Kentucky are encouraged to be mindful of their use of healthcare services and to use each aspect of community healthcare services appropriately. KHP program serves 2,024,649 rural residents in Kentucky. Of this population being served, 9.5% experience psychological issues. This is a great start in providing mental health services to rural communities. However, much more work remains to be done. There are current efforts that are being made to address the issue. The University of Louisville Trager Institute is working to meet this need in rural Kentucky through its federally funded Flourish Care program. Beginning in 2018, the University of Kentucky Trager Institute places around 38 students each year who specialize in behavioral health into over a dozen rural health care sites across 10 rural and underserved communities. In this program, students provide direct behavioral health interventions at primary care practices as well as inpatient homes. Another measure being taken is the implementation of telehealth services. Telehealth has the potential to give frontier patients access to primary care providers and medical specialists, improving the quality of care and healthcare outcomes. Telehealth may also reduce the costs of both obtaining and providing healthcare. Statistics show that 39% of all people living in rural areas of Kentucky do not have access to advanced broadband internet, and 19% lack access to even basic broadband, a factor that limits the types of telehealth services available to them through home internet connection. However, Kentucky has set out to change these statistics. In 2015, Kentucky began to implement the Kentucky Information Highway 3, KIH-3. The goal of KIH-3 was to bring broadband internet into every county of Kentucky. Along with KIH-3, the Kentucky Wired program and the so-called AT&T bill passed in 2015 by the Kentucky legislature. This gave AT&T more freedom from regulations when placing lines for home phone service, which can now include broadband. Kentucky was the first state in the nation to have high-speed internet in all of their public schools. As of 2018, the 120-county Kentucky Wired program was complete in September at a cost of around $324 million. Do the benefits outweigh the cost? Because 120 counties now have access to broadband internet, Kentucky can now begin developing a more strategic plan to bring telehealth services to these 120 counties, most of which currently has little access to mental health care. With programs like Kentucky Wire, new laws that is allowing more lenience on communication regulations and accessible internet in rural communities for telehealth services, Kentucky is making strides in the right direction towards accessible mental health care. However, gaps still can be seen. Kentucky ranks 42nd in the nation for rural communities that live in or below the poverty level. These are the same communities that the underserved mental health care population reside. Even though many of the rural communities now have broadband access, most of those who would benefit the most from telehealth services cannot afford the added burden of the expensive cost of broadband. This is a gap that can be bridged, but only with the progressive efforts of our state leaders. Community leaders such as mayors, local service organizations, town and city magistrates, and other community residents who desire a change can build a coalition of allyships with the macro client population in question. Macro-level service organizations like the Social Service Agencies, the Appalachian Region Commissions, ARC, the State Health Improvement Plan Committee, and the Department of Health and Human Services of Kentucky to bring accessible mental health care to all rural areas of Kentucky. These individuals, leaders, and macro-level organizations have the greatest influence on those lawmakers who can help achieve this goal.